All right, we're good to go.
Thanks, Jonathan. Welcome, everybody. I am so thrilled that there are so many participants here. Thanks for taking time out of your weeks, especially, at our normal dinner time. So we'll try to move through this pretty quickly. But I'm really hoping that this is valuable information for everybody that's here. And we're excited to get started. So like Jonathan shared, my name is Bristol Lopez. I am the district social worker placed at Cypress High School. And I am joined by Rebecca Gomez, and she is the district social worker placed at Lexington Junior High. And we are in the school-based mental health realm. So we are doing this presentation as part of Suicide Prevention Awareness Month. And many of you may know that on Friday, September 8th, we actually had an event during lunch for the students at all of our sites all across the district. So this is really our effort as a team of social workers and just really the team of mental health professionals within the school system. This is our effort to engage everybody. So students, parents, staff, everybody. So we're really happy that you're here, and we'll go ahead and jump in. So Jonathan, you can switch to the next slide. Thank you. So we're jumping into suicide prevention for parents. So what does that mean for you as a parent? And it was noted on the other slide, there will be time for questions kind of in the middle and then also near the end. So please write those in the chat. Those will go directly to us. There will be time in the middle for sort of a reflection, and then at the end, we'll have time for all of your questions. And so I would love it if you were starting to think about what you are hoping to get out of this. And then if for some reason we don't address a question that you had, save that for later, and we'll spend time at the end to kind of go over those questions just to make sure that this information is valuable for you. So we can go to the next slide. So this is the layout for tonight. We're going to do some true or false, myth or fact before we really jump into the meat of the presentation. We'll have time for reflection. We're going to get into what it looks like to have school-based mental health services at each site in the district, and then how we can implement these things in the home. All right, and Rebecca, I'll turn it over to you for our first myth or fact, and we can go to the next slide.
Right, thank you for introducing me. Yes, I'm Rebecca Gomez, the social worker at Lexington. The first true or false that we're going to do, and you can play along, there's no winner or loser. We're just doing this for fun, a fun way to introduce the topic that's actually pretty hard to listen to. So first, does suicide usually happen without warning signs, true or false?
I believe you can write your answers in the chat.
Yeah, you guys should now have access to messaging everyone, so I enabled it.
Yeah, so I know some of you are probably doing other things, but if you do have an idea, type those answers right into the chat. Let's see what everybody's saying.
All right, I'll stop it there. We'll go on. So we did want to respect your time. Let's go on to the next slide to find the answer. It is actually false. So whenever someone is considering taking their own life, there's always warning signs. We might not see it at the time, either because we're preoccupied with other things, or it's a little bit hard to consider that somebody would be feeling that way, but there is always at least one warning sign.
Thank you. Yes, and we'll get into what those warning signs are a little bit later. Great participation. All right. True or false, talking about suicide makes people more likely to kill themselves? Okay.
And I'm getting a lot more falses also as direct messages. So families, if you click the little blue name, my name right there, you can go ahead and actually change who you send that to. So you can put everyone in the meeting and that'll send it into the general room. But yeah, I got a lot of direct messages that said false.
Thanks, Jonathan. And you can switch to the next slide. Yes, that was unanimous. The answer is false. So this can seem sort of like an outdated thought, but there are still many people that believe that if I talk about it too much or in too much detail, or I bring it up at the wrong time, that could trigger somebody. And that actually just gives them the space to be able to open up about those things. And it opens that door of communication so that they feel that they have support. So we'll move on to the next one.
Okay, so true or false? Young people who talk about suicide never attempt or die by suicide. Let's see what you think. You guys are so smart. We'll go to the next answer. Yes, correct. It is false. If somebody's talking about suicide, this is normally a warning sign that they may be contemplating it. It doesn't mean that they're thinking about it, but it is often a warning sign. And often they're looking for somebody just to listen to them, and they're scared of how they're feeling and they want someone to understand how they're feeling. So it's really important that when we hear this, that we take it seriously and act accordingly. And we'll talk a little bit more about how you can do that in later slides.
Okay, true or false? Talking about suicide provides the opportunity for communication. Sort of gave this one away earlier.
Let's see who's paying attention.
Yeah, exactly. Yes, unanimous once again. And we can move to the next slide. The answer is true. Exactly. It opens the door for communication. Even if they're talking about suicide and that's not their intention, that is an indicator that something else is probably going on that requires some attention.
All right, last one. People who threaten suicide are just seeking attention. What do you think? All right, and the answer is actually false. I know this one was a little bit half and half in terms of true or false. And the reason why this is normally when somebody threatens to commit suicide, although it can come out in a conflict, sometimes our kids will say it out loud when they're angry and you guys are in the middle of a disagreement. It doesn't necessarily mean that it's for seeking attention. A lot of times, this is their desperate cry for help, for someone to pay attention that something's wrong. And it may be or may not be that they're considering following through with suicide, but it does mean that they're hurting and that's something we need to consider. And maybe we just need to get them some help.
Yeah, and I wanted to add to that. One thing that I shared with staff when we did a very similar true or false was maybe they are seeking attention. And I would say in this scenario, that's okay. That's the attention that I actually want to give them. When we give attention to these cries for help, that does show that they have somebody that they can come and talk to, that when they do share something that's shocking or may cause a lot of emotions, that they know that somebody's going to be there with them and be able to sit with them in that. That is the type of attention that maybe they're seeking, and the type of attention that is absolutely okay to give them. And again, we'll talk about how we do that later on in the presentation. So now's the time for some reflection. We know that this topic can bring up a lot of different thoughts and emotions and opinions in everybody, and it can also be very triggering for some people if suicide or anything of that nature has maybe touched you a little bit more closely. So let's take some time for reflection to just see what everybody's feeling about this, kind of get the lay of the land. And Jonathan, we can go to the next slide. So what thoughts or emotions would surface for you as a parent if you needed to address this concern with your child, or maybe even your child's friend, which I know can come up sometimes? I think we have a hand raised by Melissa. All right, Melissa, are you able to unmute yourself and you can ask your question or share?
Are we sharing our thoughts about this question? I just wanted to make it clear.
Yes, share your
Okay.
thoughts about this question. You can share it in the chat or you can share it out loud, either way.
Oh, I was just gonna say that a lot of parents, a lot of fear and anxiety can surface, especially because they're afraid to hear the word yes. They feel like killing themselves.
Thank you, Melissa. Yes, I think you can probably speak for many of the participants here. Lots of fear and anxiety, and probably confusion too. There's just so much that goes into one, hearing that as a parent, and then two, trying to figure out what we do next, that it can cause a lot of those things to come up. Thank you for sharing. Any other reflections in the chat? Okay. Another participant shared the thought of, why are you even considering this? You appear so happy, fearful for them, sad for them. That is a really common one we'll hear, where I can remember a specific situation of somebody telling me that, you know, they seem so smiley, they seem so happy, I would have never known, or you know, there's so much going for you, right? What, like, how could this be happening inside? Okay, so another respondent said, it's scary to hear those words, but knowing how to help a person. I'm imagining you're saying, it's helpful to know how to help the person and you're willing to help them, but it's scary to hear those words. That's what I've interpreted from that. And then we're wondering, who should you as the parent reach out to for help? Yeah.
I know that a common response, because unfortunately me and Ms. Lopez have made these had to have these difficult conversations with many parents that were unaware. And it's very common for parents to be unaware because who would ever imagine that their child would go through this? And a lot of questions go to a lot of guilt, right? What did I do as a parent? So just know that a lot of parents feel that way, that they feel responsible for their child's happiness. But a lot of the times it's a little bit out of your hands, right? You're exposing them to the world, and that can be really scary.
Thanks, Rebecca. Yeah, that's a huge, huge one. The level of concern that I have seen in parents really shows me how much that you care about your kids, and at the same time feel that we need to be strong for them. And that, again, there's just so much that goes into it. So know that you're not alone in what you're feeling. Even if you're skeptical about this whole topic or you've had a different experience, you're not the only one that has thought that. And this is a space where we can discuss that. So thank you, everybody, for sharing. We'll go ahead and move on to the next slide. Just a little reminder, if you are ever concerned about your child or anybody else, maybe you're seeing some warning signs and maybe you're just kind of beating around the bush or feel like you're walking on eggshells, it is always okay to ask the question, are you having thoughts of wanting to hurt yourself? That is always okay to ask. All right, and move on to the next. Okay. So at the end of today's presentation, the hope is that 1, you'll be able to distinguish between the myths and realities of suicide. 2, understand what supports our school has to offer. 3, be aware of the at-risk behaviors and warning signs. And then 4, know how to get your child some help. Next slide. All right, let's just go over some basic facts and data about suicide. So number 1, suicide is the second leading cause of death among high school aged youth ages 14 to 18. Second leading cause of death. And when I was researching this, I believe, and don't quote me on this, but I believe the first leading cause of death are accidents. Just general accidents, like accidental deaths. And the second leading cause is suicide. Fact number 2, there are higher suicide rates among males than females. However, females have more attempts compared to males. This may seem surprising, but this data has actually been around for quite a while. It is known for males who are attempting suicide are more likely to die by suicide. But females, again, tend to have more attempts. So while Rebecca and I may see more females in our office, we do see quite a few males, and the severity does tend to waver based on gender a little bit, which is interesting. 20% of high school students report seriously considering suicide. Again, that's 20% of students report seriously considering suicide. That doesn't mean that maybe they haven't had a passing thought here and there, or a situation has caused them to think that way, but they're seriously considering it. And 4, suicide affects young people from all ages, races, genders, and socioeconomic groups. So suicide does not discriminate, nor does mental illness. It does not discriminate on who it will affect. And a lot of times I'll describe it where if there's already a pre-existing mental illness, I describe them to our kiddos as these sort of mental bullies that are in your brain, that are in your body, that are wreaking havoc and telling you all these lies. And they don't like to fight alone. They invite all of their buddies along with them. And one of those is suicide. And it's welcomed on in for a lot of our students and many of our students that are struggling with a mental illness. And it doesn't always matter if you've had a good or a bad life, or if everything's going for you, or maybe some things aren't, or if you have a mental illness or not. Sometimes there isn't an explanation. And I think that's really hard because we want to know the why. And sometimes there isn't. And it can affect everybody. All right, next slide. So this comes from the MindWise website. This is a evidence-based program that is delivered to some schools. It's called SOS Signs of Suicide. And so they found that 70% of parents were unaware of their child's suicidal thoughts. And this is an average. It averaged from about 50 to 95%, but about 75% were totally unaware of their child's suicidal thoughts. And 78% of parents on average were unaware of suicide attempts reported by their child. And up at the top, I'm just going to read this to you all. Thoughts of suicide are often hidden because youth are confused, embarrassed, or ashamed. So they may not know what's going on in their heads. They may not know that this is somewhat normal. They may be embarrassed to share it with you or others. And they may just be ashamed that they're having these thoughts in the first place, and guilty that, how could I ever want to end my life? I don't want to cause anybody else around me pain. I don't necessarily want to die, but I'm ashamed that I'm even having these thoughts. So we'll move on to the next slide. Okay, so this requires some more participation from you all. From your perspective, what do you think are some warning signs that indicate high risk for suicide? I'll give you some time to respond in the chat, or you can talk out loud. Now, Rebecca and I are we're in the thick of it all day, and sometimes we can kind of take one perspective, and so it's helpful to see from a parent's point of view, what are some warning signs that you see? We're only at one setting, but you're in the home. Maybe are exposed to a little bit more. So I read self-harm. I'm seeing withdrawal, drastic mood swings, depression, searching for weapons. Yeah. Changing grades or behavior, giving away items. You all have done your research. Seclusion, isolation. Depression again. Change in appetite. Yeah. Oh, you all are, I love how eager you are to participate. Anger, lying, drug usage, searching online for toxic substances. I can barely keep up. Lashing out, looking sad, hopelessness, sadness, changes in mood again. Giving away their belongings. Yeah, I barely even need to go over the next slide. This is really good. Wanting extra attention and isolation. Okay, Jonathan, we can go ahead and switch to the next slide. So yes, these are some common warning signs. Saying I want to kill myself, or I'm going to commit suicide. just blatantly saying it. That is one of the big ones. Giving verbal hints such as I won't be a problem much longer, or if anything happens to me, I want you to know. Those can be very, very tricky. Now, we hear this a lot in the school too. We'll hear things like, I don't want to be a burden to other people. Nothing's going my way. Nothing's ever going to work out. I don't have anything here for me. Those are very vague statements that sometimes can sound dramatic, but we may want to look into a little bit more. And you guys got this, giving away their favorite possessions or throwing away important belongings. Suddenly becoming cheerful after a period of depression. So maybe they've gone through a depressive phase, and then now they have sort of this plan B, this exit strategy that's giving them some relief. Writing suicide notes, changes in eating and sleeping habits. You guys got that? I'm not sure I saw one on sleeping habits. The sleeping is actually a really big one. And this is probably one of the, I don't want to say number one, but top 5 issues that I see in a lot of our youth is the odd sleeping habits and the difficulty falling asleep at night, sleeping too much, sleeping too little. And we all know eating and sleeping, if we don't get those things, that drastically affects our mood. And sometimes our youth don't tend to put that together. Loss of interest in usual activities. So things that they were enjoying before, they're not anymore. And they can't even get out of the house to even go do those things. That's also a sign of depression. Withdrawal from friends and family members, acting out behaviors and running away. We always like to say that every behavior is a communication. So even though they may be acting out or acting bad or having outbursts, just generally maybe not following the rules or disobeying the rules more than often or more than usual, that's an indicator of some sort of that I'm needing something, I'm needing attention in some way, and I'm not getting a need met. So I'm using this behavior to meet that in a roundabout way. Alcohol and drug use. A lot of times our youth and our kiddos, they will use those things as a way to numb the pain, a way to cope with it, a way to get temporary relief. A lot of them, if they've been depressed for quite a long time, they'll forget what it's like to feel happy or feel pleasure or feel any type of just calm. And I've had them report that they use the drug use to help with that. And then on the other side of things, it ends up making the problem worse. Neglecting their personal appearance. So sometimes we'll see this where students are wearing the same thing every single day. Maybe unsure if they're taking care of themselves. Are they engaging in their personal hygiene practice? Unnecessary risk taking. So are they engaging in risky behaviors and things that maybe we as adults would say, that's dangerous. That's never something that we would want to do. And for them, not being very future focused, the risk taking doesn't tend to affect them in the same way. And then obsessions with death and dying. So sometimes we will have students submit writings of this nature. We'll see drawings about this. This is why we do a presentation with staff members also, because students can turn things in that may have some themes along these lines, and teachers are aware of what to look for, and then they know to alert us because the student may be obsessed with firearms, or they may be researching those toxic substances, like we said. And there are some ways that we can kind of start seeing that. Next slide. Okay. And then, I'm sorry, Jonathan, I'm having a hard time seeing the whole presentation. Is that just me? Because I'm not seeing the title of the slide.
I can see the whole thing. So I don't know.
It may just be me, and just so I'm not going to say the wrong thing, Rebecca, can you read me the title of the slide?
Yes, these are risk factors.
Thank you, thank you. I think I may have messed with the proportions of my screen before this, and I'm not going to make you all watch me figure that out. So thank you, Rebecca. So warning signs and risk factors. There is a distinction between warning signs and risk factors that, again, we went over with the staff as well. So warning signs are like the red flags. They're the things that we start to see that are indicating that maybe our youth, maybe our child is having these thoughts of suicide. The risk factors are like the precipitating events. So the things that can kind of start that snowball effect, or the straw that broke the camel's back, that can kind of push them over the edge or confirm for them that this is the right choice. And that can be a recent or serious loss, a psychiatric disorder, like a mental illness, like depression, anxiety, bipolar disorder, things along those lines, prior suicide attempts. So if they do have a history of attempting suicide, or somebody in their family or their close circle has a history of it, alcohol or substance abuse, a family history of suicide, like I shared, bullying, and this doesn't necessarily have to be serious bullying, but if it happens over a long period of time and it's degrading their own sense of self-esteem, that can really affect them. Lack of family support, and this doesn't always mean that it's not there, but it can mean that they're not interpreting it as support. And then struggles with their sexual orientation or gender identity. There is a statistic out there that LGBTQ youth are 4 times more likely to attempt suicide than their non-LGBTQ peers. And we'll move on to the next slide. And Rebecca, I will hand it over to you.
All right, thank you. We do have 20 minutes left, I think. So I'm going to breeze through this a little bit so we can spend more time specifically on how you can support your children at home, because I feel like that'll be more useful to you. Let's go to the next slide. Okay, so how do we support students here specifically with their mental health? By acting, caring, and treating. And what that means is when we do identify a student that's struggling through an assignment, maybe a teacher that sees them day in, day out, they notice that now they're not participating as much, or they have their head down, or they look tired, or they're wearing the same thing every single day. That's when they act, and they either ask the student how they're doing if they have that relationship, or they bring them up to us. The counselors, school social workers, the school psychologists, those that know how to support students. And then we just listen to them to understand. So we make them feel validated. Sometimes their problems can seem like no big deal, right? I bet there's plenty of times you're like, this isn't a big problem. Why are you worried that you lost your cell phone? But to them, it could be a really big deal. And letting them know that it's okay to feel those feelings is really important. And then moving forward to figure out what the solution is for the student, either treating the mental illness or finding the person that can support them with whatever struggle they're having. Let's go to the next slide. So what do we do as a school? Like we mentioned, we have those monthly campaigns to support students. So we just had the Suicide Prevention Awareness Month campaign event that happened last week. We have screeners. So what that means is it's a survey that gets sent out to all 1 grade level, and it asks specific questions to really assess where the students are struggling, and if there's any safety concerns, we get to go to them right away. And this is especially important for those students that don't feel comfortable asking for help. It helps us identify them so we can help them out. We have supports that don't directly address specific student concerns, but it's kind of just overall general teaching them skills to deal with conflict and stress and anxiety and sadness through counselors, social emotional learning in the classrooms through presentations. Well, for the students that have specifically struggles with conflict or social emotional skills, we do therapy groups or skill building groups. And we do parent presentations like today to build you guys up so you know how to address students that are your students that are having trouble at home, or your students' friends that are also struggling. But we also have mental health clubs on campus, which is really awesome. I'm not sure, I can't remember what it's called at Cypress, but the one at Lexington's called Be Kind to Your Mind. And it's really building up students to advocate for mental health, to build up other students, to build a culture of helping and supporting each other so that bullying and other of these risk factors that end up showing up are less frequent. Let's go to the next slide. Oh, right. I forgot, these are cool pictures. So these are different pictures from the Mental Health Awareness Day that we had last year and the Suicide Prevention Awareness Day. So here's a little positivity with all the tough topic that we've been covering. And as you can see each side, we have Bristol on one side. If you can, where's Waldo? Me and her, the pictures are kind of tiny. But let's move on to the next slide. Okay. So specifically for suicide, let me look at my notes here. In 2016, California passed the Pupil Suicide Prevention Policy that basically made it a requirement that all school districts have to adopt a suicide prevention policies in order to address the increase in suicide attempts. Like you saw, it's the second leading cause of death in students. Let me mute my walkie, hold up. Sorry about that, I'm at the school and the walkie was going. Were you able to hear that? Hopefully not. Okay, never mind. So because of that policy that was passed, AUHSD has really worked on developing this system to not only identify students, but to address how to support them if there's safety risks or mental illness. So we use specific procedures and a really good screening tool that is very effective. We've kind of streamlined it to identify the level of risk and really provide the appropriate intervention or support for these students. So after completing the screening, there's many different ways. Obviously, it depends case by case basis, but we support linking those students to either being hospitalized in the most intense cases. We partner with the Be Well Center in Orange County, which is kind of a lower level to stabilize students that are having these intense thoughts of wanting to follow through with hurting themselves. There's in-home crisis, which is kind of the support comes into the home to stabilize the student if they feel safe that they can stay at home. And then of course, therapy services. Let's go to the next slide. And then as a whole school, we really work as a team. So we have reentry meetings for whenever a student returns from a long stay. Normally, if they're hospitalized, if they stay in a shelter, there's many different reasons why a student might have an extended stay outside of school, but we hold meetings to really problem solve and strategize how we can transition the student back into schools, just with the least disruptions as possible. We have staffings, and then it is educational monitoring team meetings. That's what EMTs are for. And really all of the meetings in general, they have the same goal. They differ in terms of what professionals attend each meeting, but the main goal is to figure out how to meet the students' needs, because all of us have unique perspectives and skills to support students, but it's a matter of working together, work smarter, not harder together to really make sure the student is successful and is feeling supportive and, mentally healthy. So that's what we do as a school. Does anybody have, I guess we can ask for questions at the end. I know I went through that really quickly. Please save your questions for the end. I will be more than happy to go over any of the school information at the end, but I really want to make sure we get into the meat and potatoes of this meeting, which is how can you help your kids at home? All right, next slide. So there's a lot of things that you can do. it wouldn't be necessarily treating the mental illness, right? We're not expecting you to do all of that. That's really hard work. It's the most important thing that I can't stress enough is really listening to validate them. I know I touched on this a little bit before. A lot of times as parents, or even me as a friend, when you have somebody that's explaining a problem to you, I think your first instinct is we're problem solvers. We want them not to hurt anymore. So we want to provide a solution, but that's not necessarily what you need. Sometimes you just need someone to sit there with you in those negative feelings and hear that, you know what, you're not crazy. What you're feeling is normal, or that's really hard, or just feel that what you're going through is difficult and to know that you're not alone. So that's one of the biggest things. And other instances, if you see your kiddo's low and he's like, you know what, I don't want to talk to you, or she says, I don't want to talk to you, really promote self-care. So what that means is, you know, do a face mask or take a, you know, hot shower, really relax. I don't know about you, but a nice hot shower helps me. It can go for a run or a walk, anything to do with exercise or eating healthier meals. That's self-care, or anything that's a positive coping skill. So what that means, a coping skill is a very fancy word for anything that makes you feel better or it distracts you from what's going on. Because a lot of times our students, because they're minors, they don't have a lot of control over their life. They don't have control over the classes that they have to take, or PE, running the mile. They don't have control over the friends that they make, the way people react around them, the chores that they have to do. They're just sitting in they don't have a lot of control over their lives. And sometimes to get through these things that they may disagree with or they may have difficulty with, it's just simply encouraging them to do things that they enjoy to minimize, you know, the negative feelings that they have over the math teacher that they hate, or the project they have due next week. And like I said, it could be like drawing or doodling. Coping skills can look like anything. Give me some examples of coping skills that you guys have. I think that's a good idea. Transition.
I like that, Rebecca. Whether it's coping skills you encourage your children to use or coping skills you yourself use. I like to exercise. That's my big one.
Eat good food. Oh my gosh. That's both good and bad. But definitely comfort food for sure after a stressful day. Bike ride, going for a run, yes. Drawing, yes, absolutely. Anything that's creative is really, really helpful. Oh, counting backwards, yes. So relaxing techniques, that's definitely one of them. I know I didn't mention it yet, but breathing techniques. I will say not everybody is super into mindfulness, but that is very helpful. Listening to music, having a nap, or yeah, just closing your eyes for a minute, just to give yourself a minute to relax. Yes, quality time. Absolutely. I think that's really big, Melissa, is that if you make time, just 30 minutes a week, just to intentionally spend time with your child, to let them know that you care, I think goes a really long way. Even when they're giving you attitude, because this is around the age that they give you attitude. Yes, listening to others, to being there to support them, but also feeling supported. Journaling, yes, amazing. Playing with your dog. Oh my gosh, fur babies are the best. Absolutely. And I think going into this, really not only encouraging your children to practice these positive coping skills, but also doing it in front of them. So not necessarily like showing that you're stressed out, you're doing a coping skill, but showing them that you're practicing these and they can practice them as well. Because sometimes we give them this support and this advice and they're like, well, I never see you do it. So like, it's almost like practice what you preach, which can be very hard, including with us social workers. You know, we're adults, we're human beings just like everyone else. It can be hard to prioritize ourselves, but showing our children that we can do that, I think goes a really long way. Let's see, did I miss anything? Yeah, I think that's pretty much it. Anybody have questions about that, about any of the things that I mentioned? Let's move on to the next slide. Okay, so the previous slide discussed how you can support your students in general, whether you see that, they're a little bit low, or they're looking a little stressed or anxious, that's how you can support them. Specifically, let's talk about how you can have these really difficult conversations, right? So you see your kiddos sleeping too much or sleeping too little, and now they don't want to talk to anybody, and now they pretty much just lay in their room and cry all day. You're really concerned for their well-being. How do we check in on them? You have to choose the right time. We have to make sure that when you're having that conversation with your child, that you're in the right place, right? Not in a grocery store or in front of a bunch of people. Choose the right time. It could be on the drive home if you pick them up. Or it could be you sit in their room where it's quiet and private. You have to be ready for them to kind of push back, right? I'm sure you're all used to at least having a little bit of attitude thrown your way from your children. Be ready to not only let the attitude come at you, but don't take it personally. It's coming from a place of fear, right? They're not sure if it's safe to be truly honest with you about how they're feeling. And stick to the facts. Say, hey, little Johnny, I've noticed that you used to sleep really well and now you're having trouble sleeping, and your grades are dropping, and now it's really hard for you to wake up in the morning. This isn't what used to happen. What's going on? I really want to help you. I really want to understand. And like I said, really validate their feelings, because I think once we say well, that's not a big deal, or don't worry, you'll get over it, or well, back in my day, this wasn't that hard. I had to deal with this. I think we have a tendency to go back to our own experiences, but they're living in a generation that has a lot of differences than the way we were raised. And sometimes it's hard for us to really understand how they're feeling and their experiences, but not jumping to conclusions that what they're going through isn't a big deal, and just sitting there with them in their feelings. And like Bristol said before, at the very end of the day, it's always okay to ask, because I've had plenty of students where I've asked them and they're like, oh no, that would never happen, which is totally fine. There's nothing negative will come from asking. I mean, they might, give you a little attitude, but I think we can all survive that. Okay, next slide. So, right, you guys pretty much named almost all of these, I think, except for therapy. But of course, you can encourage a student to do therapy. You look for that service for them. So all of these are really great things. There's a million and one different things that you can encourage your teenagers to do. Everybody's gonna have a specific, coping skill that's gonna work for them, and just know that not every coping skill is going to work for everyone. We're all different in our unique ways. So yeah, just encourage them. Your kids the best. Encourage them to do the things that they enjoy, or to try new things. And next slide. Yes, you don't have to do this alone. We're here to support you. We're here if you have any questions. If you notice anything in the future, me and Ms. Lopez are at the school all week long. So if anything ever changes, you can always reach out for help. There's help to be given here. And as you can see, there is 43 other parents here that are also, having concerns, or not concerns, but they want to learn about this. They want to support their children, and they're probably feeling very similar to how you are feeling. So you're not alone in this. And I think that concludes our presentation, but we'll stick around for questions if you have questions. Oh, just kidding. There's resources. I jumped the gun.
Rebecca, could I jump in real quick?
Yes, you may.
Okay, just so we don't lose our train of thought. And then we'll talk about these resources. I tend to talk way too long, so I'm going to try to keep it super concise. I wrote down a couple of things just as you were sharing, Rebecca, things that popped up for me that maybe could help us in understanding what else can we do. Just practical things. So one thing I recommend for families when we're trying to check in with our kids, because I hear a lot where, well, I ask them about their day and they don't share anything. And they just say, good, fine. And we don't get any response, right? And then it's like, how can we engage in this discussion if they're not even willing to talk to me? And one of the things I recommend is not right after school, because they're coming in with whatever happened that day at school and also may need some time to just decompress. Usually around the dinner table or as we're getting ready for bed, starting to wind down, I recommend doing highs and lows. So what was a high from your day? What was something good that happened? And what was a low from your day? What was something not so good that happened? And even if it's a weekly thing, do a high and low of your week. And that way it's more specific and direct. It's not just, well, how was your day? How's school? How are your grades? And then in that way, they can start to think that, well, all they ever care about is school and all they ever care about is how I'm doing. Not that that's the only thing you care about. But sometimes that can be how they interpret it. So highs and lows. My other one was going to say, I want to give you all the permission to continue to set boundaries and set limits with your kids, even if there is a mental illness or suicidality at play. I think it's common for us to kind of start walking on eggshells when we know that there's this safety concern here. And it's easy to start kind of giving in to things and letting them kind of have their way. And this is very tricky to navigate. So I recommend talking to their therapist about it, talking to Rebecca or myself about this. But usually in those scenarios, they still need structure. They still need limits. They still need to know what's okay and what's not. And it's okay to enforce that. Of course, as long as the home is safe. Yes, there's going to be big emotions. There's going to be anger still. That doesn't always mean that there's a safety concern. But I think it is important for them to still have those limits. And then lastly, I just want to encourage you to notice what's happening in your own body and your own mind when you have conversations like this, or if your child brings up conversations like this. Notice what your reactions are, because a lot of times that will influence how you respond to them. And sometimes that can be, oh, I don't want them to do that. Oh my gosh, then I totally dropped the ball. It could be, oh my gosh, I'm worried out of my mind. And then it comes out as anger. I just want you to notice what sort of comes up for you, because they are very receptive in those moments and very sensitive to those responses. So be aware of that. And it's okay to kind of let them know, like, I'm having a hard time with this, but I'm here for you. This is really overwhelming for me, but I am with you in this and we're going to figure this out. That way they see your humanity and they also see that, okay, they're kind of freaking out too, but they're also going to be here for me. They're not going to abandon me and they're not going to judge me for this. I think is really, really important. And since I'm already kind of chatting away, Rebecca, I can go over the resources really quickly. These are all of the different hotlines that we give to students and that you can also use as well. You can have your child text these with them, next to them. You can say, you know what, I think it's a really good idea if we utilize one of these hotlines. Why don't we get on and text somebody? You can call somebody. And then very specifically, I think somebody may have asked this, what do you do if you hear your child say, I want to kill myself? What do you do if you are in that state of panic and this is a big deal? Number one, you can go to your local emergency room. So if for some reason this were to come your way, you can take your child right to your local emergency room. We usually recommend CHOC, and they will do an evaluation there to determine the level of risk. You can also call 911 if you are very concerned. And then also these hotlines will be able to give you direction as well. One thing I really like is that Grit X app. I recommend just giving it a little browse because it has hotlines on there, but it also is a resource just for mental health in general. And it's created by licensed therapists. And then Rebecca found this wonderful resource. It's the California Parent and Youth Helpline. Like you see there, it offers parent helpline and online parent support groups to address stressors and concerns faced by families and parents. And then at Cypress, we do have a wellness corner. The counselors have created a really awesome section on their counseling website where students can go and get tons of resources for their mental health. So let us transition finally to questions, and I'll stop talking finally. And you can write them in the chat or you can raise your hand either way.